Do you know what causes asthma and its symptoms? Welcome to our deep dive into asthma, a common yet often misunderstood chronic condition that affects millions worldwide. Our journey today takes us through the maze of this ailment, exploring its causes and symptoms. Asthma, in essence, is a condition that inflames and narrows the airways, leading to a variety of symptoms that can range from mild to severe. Understanding asthma is not just crucial for those who live with it, but also for the people around them. It empowers us to empathize, support, and even save lives in critical situations. Knowledge, after all, is our best tool in managing and mitigating the impact of this condition on our lives and the lives of our loved ones. So, what exactly causes this condition? Let's find out. When it comes to asthma, several factors can trigger an attack. Unraveling the root causes of this condition is a bit like piecing together a complex puzzle, as it can vary widely from person to person. However, researchers have identified a few key pieces that seem to be common in most cases. Firstly, let's talk about genetic factors. You may not be surprised to learn that asthma often runs in families. If your parents or siblings have asthma, your chances of having it are significantly higher. This suggests a strong genetic component to the disease, but genes alone aren't the whole story. Next, we delve into the realm of environmental factors. These are elements in our surroundings that can trigger asthma symptoms. They include allergens such as pollen, dust mites, mold spores, pet dander, and even certain foods. Exposure to these allergens can cause the airways to become inflamed and narrow, leading to an asthma attack. Air pollution is another environmental factor. Studies show a clear link between air pollution and asthma, especially in urban areas where pollution levels are typically higher. Chemicals in the air we breathe, such as car exhaust fumes and industrial emissions, can irritate the lungs and trigger asthma symptoms. Lastly, certain health conditions can also contribute to asthma. Respiratory infections, particularly in early childhood, can damage the developing lungs and increase the risk of asthma later in life. Conditions like obesity and stress can exacerbate asthma symptoms, making it harder to manage the disease. Remember, these are just potential pieces of the puzzle. The exact cause of asthma can vary greatly from person to person. Some people might be more affected by genetic factors, while others might be more sensitive to environmental triggers. It's crucial to know that understanding your own asthma triggers can help manage the condition better. Now that we've covered what causes asthma, let's move on to the symptoms. Asthma symptoms can be quite varied, and they can change over time. One of the most common signs is shortness of breath. This happens because the airways of an asthma patient can become inflamed and constricted, making it hard to breathe. Imagine trying to breathe through a narrow straw. That's what it can feel like for someone with asthma. Another common symptom is a feeling of tightness in the chest. This sensation can be uncomfortable and even frightening, as it can mimic the feeling of a heart attack. It's caused by the same constriction and inflammation that leads to shortness of breath. Wheezing is also a frequent symptom of asthma. It's a whistling or squeaky sound that comes out when you breathe. This is caused by the air trying to squeeze through the narrowed airways. And let's not forget about coughing. Persistent coughing, especially at night or early in the morning, can be a sign of asthma. It's the body's way of trying to clear the airways. These symptoms can range from mild to severe. Some people might experience them daily, while others may only have them occasionally. It's important to note that these symptoms can also be caused by other conditions, so it's always a good idea to get a proper diagnosis from a healthcare professional. Remember, recognizing these symptoms is the first step in managing asthma. So, to recap, we've explored the vast landscape of asthma, delving into its causes, which range from genetic factors to environmental triggers. We've also shed light on its symptoms, such as shortness of breath, chest tightness, and coughing. It's crucial to recognize these signs early, as understanding is the first step towards effective management. Remember, knowledge is power when it comes to managing asthma. Thank you for watching and stay healthy.